Hi friends, morning. I'm Dr. Ashutosh Gupta, and today we are going to talk about the abdominal cord insertion abnormalities into the fetus. Right, as we know that the baby is connected to the mother through that umbilical cord which inserts into the abdomen. Right, तो वो जो abdominal wall insertion है, जब उसकी कुछ खराबी होती है, तब हम उसको abdominal wall insertion abnormalities के रूप में जान सकते हैं और सामान्यतः वो तीन तरह से होती है. राइट, तकरीबन हम ऐसे समझते हैं कि 9 हफ्ते या 8 हफ्ते पे देर इज यूजुअली जो बेबी की जो आंतें होती हैं, जो गट होती है, वो अम्बिलिकल कॉर्ड की बेस में आ जाती हैं, which they usually regress back, so which is called as a physiological gut herniation. But what we believe is this, that 11 weeks and 6 days, so meaning thereby 12 हफ्ते के नीचे नीचे तक we can label it as a physiological gut herniation. If the baby is greater than 12 weeks, then it becomes abnormal, right? पहला ये होता है कि वो बेस में ही एक टूम जैसा बन जाता है, एंड देन वी कैन हैव द हर्निएशन ऑफ द लिवर and some other part of the abdomen, which can be small intestines, and being covered by a membrane, and therefore the umbilical cord insertion is there on the top of it, and therefore it is called as an Omphalo. And if we identify that the abdominal cord insertion is normal, and then we are identifying that the part of the small gut is freely floating like Maggi noodles into the abdominal cavity, into the amniotic fluid, out of the abdominal cavity into the amniotic fluid, and therefore it is called the gastroschisis. Many a times we identified that the normal cord insertion and some part of the gut gets leaked into the base of the umbilical cord, and the small part of the gut, small intestines, which is there in the base and in the umbilical cord itself, it is called as an umbilical cord hernia. राइट, तो वो आज मैं तीनों केसेस में आपको दिखा देता हूँ. तो इसको ध्यान से देखिए. सो दिस इज बिल्कुल एक स्फेरिकल स्ट्रक्चर है. इट इज सराउंडेड बाय अ मेम्ब्रेन, and we can identify the umbilical cord insertion. So this is an omphalocele. चूंकि ये DADC twin था, so we are just reducing. This needle is there in the cardiac, in the heart, and therefore we are reducing this baby, right? And this is at 9 weeks. So normal cord insertion, but a part of the small intestine is herniating into the base. So this is a physiological gut herniation, right? Which is all normal. Now the this is a DADC twin, but we are identifying at 13 weeks. So what we can see कि ये turban-like and irregular structures, and then the small intestines, they are out of the abdomen, and therefore they are freely floating in the amniotic cavity. आंतें जो हैं वो abdominal cavity से बाहर है, amniotic fluid में है, and we are just waiting for the baby to turn. And this is also a DADC twin, and we would see the, so this is an irregular, so yeah, so this is, you can identify and can see that this is an irregular structure. So this is a gastroschiasis. Okay, so we don't have any layer, we don't have any membrane, and then this gut are freely floating. So this is how the baby would look like after the baby is born, right? And this is a third variety in which we identify that the umbilical cord, abdominal wall insertion is absolutely normal, and then we are identifying that some part of the small intestine gets leaked into the base of the umbilical cord, and it is there in the umbilical cord itself, right? Okay, तो इसको देखिए, ये abdominal cord insertion बिल्कुल normal है. ये, this is a small area through which the small intestines are leaking into the base, and therefore it is called as an umbilical cord hernia, right? So we actually need to differentiate between these three structures: omphalocele, gastroschisis, and the third one is an umbilical cord hernia, right? And this is sort of an, we really don't get worried about all these things, and probably we'll talk about how do we manage and how do we follow them out across, and then right. So this is an umbilical cord hernia that we are talking about, right? Whenever we identify that the mass which is getting out of the abdomen, it is all spherical, and it is covered by membrane, mostly has got part of the liver, vis-a-vis with some amount of the small intestines, we call it as an omphalocele. Omphalocele can be associated with chromosomal abnormalities and Beckwith Wiedemann. So we have had one case in which we have had that Beckwith Wiedemann sort of a mutation we identified. So this is how probably we need to follow them out across and all the stuff. If the chromosomes, they turn out to be normal, and the prognosis for the omphalocele is good as compared to the second variety, which we call as a gastroschisis. Now, in gastroschisis, what happens is this: that the small intestines की जितनी भी loop हैं, they are very free, and then they are in contact with the amniotic fluid. So what happens is this, that that amniotic fluid is a chemical irritant, and creates a sort of an chemical inflammation to the wall, of the gut, which is eventually lying for almost 20 weeks or 24 weeks in the amniotic fluid, right? And therefore we can have short bowel syndrome, we can have some issues regarding the peristalsis when the baby is born and we try to put this intestines back into the abdomen. So they can be swollen up, they can be soggy, they can have a lot of complications, we can have short bowel syndrome also, so we can have loss of peristalsis. So probably all these things they need to be discussed. Even though we identify that the gastrochassis is not associated with chromosomal abnormality, but the vis-a-vis the gut functions in a gastrochassis is not up to the mark, right? So all these things they need to be sort of counseled very well when we make a diagnosis at something around 13 weeks. Right, and the third case is an umbilical cord hernia. Now, umbilical cord hernia is absolutely a normal variant. We have had some three cases, and eventually, what we identify that there is some amount of an small intestines loops they get leaked across into the base of the umbilical cord. So, only thing is this that probably we need to follow out across for a small bowel obstructions, signs for all those obstructions as we move on further. It has not been associated with any chromosomal abnormalities and hardly anything to get worried of. Only thing that probably we need to identify is this that when the baby is born, we apply the umbilical cord stump, umbilical cord tie we apply. So probably that has to be tied further up so that you don't injure the umbilical cord. You don't injure the small gut which is there in the base of the umbilical cord. So that is some a precaution that probably we need to identify, and this needs to be taken around before this umbilical stump sheds off from the abdomen, right? Okay, so that is how it is. So umbilical cord hernia, it is not that sort of a worrisome, and only thing is that probably we need to identify is that probably we need to tie the umbilical cord tie stump slight above the usual thing that we usually do, right? Thank you very much for your patience.